Care Clinic. Care Clinic. One of the most effective ways to fix a damaged hip is to replace it surgically.
Explain total hip replacement in brief.
In a total hip replacement, part of the thigh bone, including the ball, is removed. And a new, artificial ball is fixed into the end of the stem of the thigh bone. Next, the surface of the existing socket in the pelvis is roughened or widened and level with a smooth pad to accept a new socket component that will join up with the new ball component. Together, these components replace the natural ball and socket joint and allows free movement against the pelvis. The hip replacement parts can be plastic, metal, or ceramic. The shell, also known as acetabular cup, is available in two types: normal, deluxe. The liner is available in two types: plastic, ceramic. The femoral head is available in two types: metal, ceramic. The final component is called as the femoral stem, or prosthesis, which is made of metal.
Why is there a cost variation for a hip replacement surgery?
The cost variation is mainly because of the different kinds of bearings we use. The bearing type, the type of the shell we use with different coatings are various parameters by which the longevity of a hip replacement can be increased. That is why a patient needs to understand which kind of a bearing his doctor is using and what amount of money he should pay. My advice would be to go always for a costlier bearing, because it is a one-time procedure and it should last as long as possible.
Why do we use different quality of bearings?
We use different quality of bearings because the hip replacement should last longer. Hip replacement patients can be as young as 20 to 25-year-olds as against somebody who is 75 to 80 years old.
Explain the various kinds of bearings and its importance.
There are various kinds of bearings, and the main three types are metal on plastic, ceramic on plastic, and ceramic on ceramic. The metal on plastic is the most basic bearing and is the cheapest. However, the metal can wear out plastic earlier, and that's why in a 22-year-old it won't last the entire lifespan of the patient, which approximately say would be 60 years. When you change that to ceramic, and by ceramic I mean the material which we see in our wash basin or sinks, the hip can last longer. Now we keep saying that we get a 22-year-old patient for a hip replacement and we want to use a hip which will last longer. For such patients, we use a bearing called as ceramic on ceramic. This is the costliest bearing surface available. Also, to make sure that the hip replacement lasts longer, we sometimes have to use different techniques to integrate the shell to merge with our own body. Scientists have now given us new coatings which make these shells bond with the bone without any kind of grout. These special coated shells cost more.
Before-after pictures. These are pictures of patients treated by Dr. Shreedhar Archik. Dr. Shreedhar Archik runs a busy orthopedic clinic at Dadar, Mumbai. He specializes in joint replacement surgeries. To schedule appointments for consultations and surgical procedures, please call 2444-5608. or 2444-9508. Email your queries to info@drarchik.com or visit www.drarchik.com.